So this is a young woman who presented wanting more of a transformational change. So this is a patient who is actually quite model-esque. She's tall, but she was somewhat heavy. One of the things that we have to take into account is the fact that she is going to lose weight, and she said it herself. Obviously, the areas that we normally associate with accentuated features, the eyes and the nose, and facial contour. These are the three things that she really needed more definition. So let's talk about the eyes first. The thing that's more striking for her is the fact that she does have what's known as ptosis, or a lazy eye. Quick note about lazy eyes. It's something that is actually innate and very, very common in Asians. And that lazy eyes doesn't just mean that you don't have a double eyelid. It actually means that there is a weakness of a muscle that we utilize to open and close our eyes. One of the things that we do when we perform a double eyelid surgery is not just creating that double eyelid, but also tightening that muscle so that the eyes open up a little bit more. It's what we call ptosis correction. The other thing that we did with her, obviously, is the nose. If we take a look at her preoperative photo, she's got kind of a usual standard Asian nose, which means just overall it's small in terms of the height, the definition, and what we call the tip projection. As far as augmenting the dorsum, we decided to go with a Gore-Tex implant, EPTFE. And then for the tip, we utilized a combination of ear cartilage along with septal cartilage. For a lot of non-Asians, sometimes what we want to do to make the nose look a little bit more cuter, a little bit more feminine, is we sometimes raise up what we call the tip angle. However, for most Asians, because there is a good amount of nostril show anyways, what we actually want to do is change the direction of the tip projection slightly down, but more forward. Out of all features of her face, I mean, she really likes the nose the best. Finally, another very important component is the bony contour. If we look at her preoperative photos, I mean, obviously her face is rounded and somewhat full. We can make a dramatic result if the patient chooses what we call a reduction mandibulopectomy. And what that means is we resected a piece of the mandible, especially at the angle, and we also reduced the width of the mandible as well. Now, this type of transformation certainly is not for everyone. Most people don't want to look completely different. However, in this patient who is in that profession where she needs to be in front of camera, that she did want more of a dramatic result. And certainly as us as plastic surgeons, we have to listen to what the patient actually is requesting.